What we have, there is a report for retirement and community homes if you need it. There's a report that can be generated in Coligo that shows when residents have reached their 75th visit, just to give a little bit of extra time for planning for physios who are going in maybe only once every 2 weeks to some of the smaller homes. If you need that extra notice, let support office know and we can make arrangements for that report. Okay? So back to the tracking sheet. So the PTA has written the date that the resident had their 85th visit. Now, once the 85th visit assessment is done and this form is filled out, we're going to document the date that the 85th visit reevaluation was done. And if we're using a previous date, that's okay. You can, if you're writing December 1st was their 85th visit, but you're using their quarterly assessment from November 24th, you can write November 24th here. That way we know you're referring to a previous assessment. Once this summary and referral form, so SAR is the summary and referral form, once that is filled out, signed by the MD or the RN in a nursing home, and in the chart you write the date that it's all filled up and in the chart. Okay? And this date hopefully will be before you get the 100th visit email, because you will also get an email that says 100 out of 100. When you open it, it'll say this resident had their 100th visit billed on whatever date. You write that date here, so you know that the very next service, or whether it be a treatment or a reassessment, the very next service that's billed in Coligo is their 101st. So you better hope that that summary and referrals form is all signed and filled out and in their chart. The last column is the 150% email date. Coligo will also send you, you'll also start to get 85% visit emails when they get to their 43rd out of the extra 50 visits. So be careful when you open your emails. It may not be another 85th out of 100. It's the 85% email date. So you have 85 out of 100 for the first 100. Once you're past that, you get the 100 out of 100 email. You're going to get a 43 out of 50, which is 85%. You don't need to record that date. That's just to let you know that in 7 visits, the resident has no more paying visits. When you get the 50 out of 50, the 50 visits out of 50, so they've had their last paid visit, it'll be 100% util email still. Write the date down, and then we know that the whole process is complete and the resident has no more billable visits. You can still continue to enter them in Coligo because they'll be unfunded visits, which is fine. You know, considering what the resident needs therapeutically for their benefit, I would much rather run out of visits and have some unfunded visits at the end of the fiscal year. Oftentimes January, February, March, a lot of the residents have run out of visits, and that's okay. I'd rather get to the end of the year and know that they've had the care that they needed versus limiting them to 2 or 3 times a week so that they don't run out of visits at the end of the year and then they haven't gotten the care that they needed. If you need further explanation on this, just let me know and I'll be more than happy to talk to you about it. In a community setting and a retirement home, because you will be faxing the summary and referral form to the doctor, the only difference is in a nursing home it says physiotherapy 85V summary and referral. In the community home it says in-home physiotherapy to keep with the nomenclature we've had before. But if you're in a retirement home or a community home and you do need to fax that referral to the doctor to get his signature, I suggest that you also please send this letter to the doc, Re-85 visit, I think it's called. This is what it looks like. And basically the letter says, "Dear doctor, enclosed you will find a summary report from a recent evaluation of your patient or patients. Only patients who are deemed to have a continuing need of physiotherapy have a report filled out to inform you of their progress and to ask for your approval. In order to be able to continue offering in-home physiotherapy to your patient or patients, we require your approval in the form of a signature. And then in the middle here it's underlined and in italics, and it says, please sign the bottom of each of the reports included in this fax and fax them back to our office at, indicate the fax number that you want them to fax it to, at your earliest convenience. And then thank you for your continued support of our in-home therapy programs. If you have any questions, feel free to contact me. You can write your phone number, print your name, and sign your name at the bottom. So please fax this along with the 85th visit summary and referral form that you'll be faxing to the docs to get their signature to be able to get those extra 50 visits for the residents in your home. One of the next things that you'll see in the PTA binder, although it'll be in black and white, is a series of exercise pictures and short descriptions that were made up in Physiotech, which is our online exercise program. The reason that this was made up is because sometimes the staff of the nursing home or the retirement home, maybe not so much in a community home, but they may be looking for what exactly is, Sky Punch, for example, or what is bicep curls with TheraBand, or AA-ROM shoulder flexion, or standing tiptoes, for example. So there's actually, this is like an exercise glossary. So it's got the names of the different exercises as well as a picture describing what the movement is, and also a short description for some of the exercises that the picture is not very self-explanatory. And it's been split up into different categories. For example, AA-ROM exercises leg, same thing for arm. You've got A-ROM exercises neck, strengthening exercises arm, strengthening exercises leg, stretches arm, stretches leg, standing balance exercises, seated balance exercises. What else do we have? Deep breathing exercises and resistance chair exercises for those of you that have resistance chairs. And this is also actually very helpful for new PTAs who are coming on board, because they may not know some of the exercises, especially if they are coming in without much physio experience. And also what I would encourage is to go through each home, go through these pages, and if you use a certain name for that exercise on your program logs that's not the same as this, just add it in brackets so that perhaps seated hip flexion, perhaps you call it seated walking or marching, seated marching or something like that versus seated hip flexion. Just put beside that name what you call it on the program logs so that it's easy for everybody to find what the exercises are, both for the staff, the nursing staff, and also for the new physio staff or people that might be coming in to replace during vacations and sick days. So that's what those exercise protocols are for. It's like an exercise glossary. Another sheet that you'll find in the PTA binder is called the group attendance sheet. This is what it looks like. So you've got, again, the group class name. So if it's your seated class or your standing class or your A-wing class or whatever it may be. Then you've got the month, so you can keep track of the month. And you can do it double-sided, so you can have 1 month on the front, 1 month on the back. And down the one side here, you can put all the names of the residents that attend that class. And then you've got from 1 to 31 across the top, and that's obviously the days of that month. So at the bottom here, you've got the different refusal codes that are part of the documentation that we do. So if a resident does not attend class, let's say you've got Mary Apple and Mrs. Peach down here and Mrs. Smith. If Mary Apple attends the class on the 5th of the month, you would write 30, if it was the 30-minute class. And then if Mrs. Peach doesn't attend on the 5th because she's sick, you look down here and the code for sick is S. So across from Mrs. Peach on the 5th, you would put an S for sick. And let's go down to Mrs. Smith, and maybe Mrs. Smith said she didn't want to participate today. So you would go down the 5th and Mrs. Smith, and you would write NT for not today. And everybody else that attended, you would write 30, 30, 30, 30, 30, 30, 30. Okay? This is basically just to help you keep track of who's attended your classes on which day, so that at the end of the day, when you're doing your stats in Coligo, you can just take a quick look at the sheet and see who attended, and then you can also see who refused and why, or who didn't attend the class and why, and it makes it easier to enter the stats into the group booking in Coligo with less chance of error. If you do 2 different classes that day, you might forget why somebody didn't attend or if somebody attended or not, and then it just increases the possibility of error. So this is just to help decrease the possibility of error. In community homes, if you would like to use this sheet instead, this is the group attendance sheet we have for you. And you'll notice that across the top on one side it goes from the 1st to the 15th, and on the back side it goes from the 16th to the 31st. Pretty much the same, except that every second line it's white, gray, white, gray, white, gray, and the boxes are bigger, because what we found is we can actually ask the residents who are in the community home to just sign their initials in the box on the date that they've attended, just so that there's a proof that they've attended. In a community setting, we may need to be a little bit more careful, so this is just an extra way to make sure that people know that yes, we are actually seeing these residents. The codes are still at the bottom, and you would fill it out the same way as the other sheet. So those are the group attendance sheets. The next form we're going to look at is the inactive residence log. And basically you've got 4 columns on this log. You've got, you could put the resident's name, then you would put the date that they became inactive. Then you can either write the date or just check off the fact that they've been inactivated in Coligo, and sign your initials as to the fact that you're the person that inactivated them in Coligo. So what does inactive mean? In Coligo, a resident is either active or inactive, and when you go to their demographic screen where they have their name, their birth date, their health card number, on the far right hand column towards the bottom there's their status, it's called, and they're either active or inactive, and this is where you update that status. When a resident is active, it's somebody who's participating in physio, we're seeing for treatments, reassessments, initial assessment has been done, they're active, they're being billed for, they're participating in physio. If somebody passes away, or if they move out of the home, whether it be nursing, retirement, or a community home, they move away, they no longer are participating in the physio program, they would have to be changed to inactive in Coligo. And also, if somebody refuses to participate on numerous occasions in physio, and the physiotherapist has deemed that this person will never ever participate, and they discharge them from physio even though they still live in the home, it's still a good idea to make them inactive in Coligo. If they change their mind later on and they decide that they do want to participate in physio, or perhaps they have an injury and now they have a need and they see the benefit of physio, just need to get a new referral, reassess them, activate, you can rechange their status to active in Coligo and update it, and then you can begin treating them again after the assessment's been done. If they are discharged and it's documented by the physio that they've been discharged from the program, we do need to get a new referral for them.